Hi, welcome to Module 2 of the Patient Compliance in Oral Care series. In this second lecture, we'll dive into the fundamentals of the GPS model and explore how it can help you build valuable skills for yourself and your patients. Let's begin by looking at some core principles of behavior change. Psychological research tells us that 3 key components drive behavior change. Capability. This is the knowledge, skills, and abilities a person needs to perform a behavior. Opportunity. These are the external factors that make carrying out a behavior possible. Motivation. The internal processes that influence decision-making and action. As dental care professionals, you already excel at building capability, sharing your expertise, teaching patients how to care for their gums and teeth, and providing them with the skills they need. But, as we saw in Module 1, even the best advice isn't always enough to create lasting change. That's where the GPS method comes in. By focusing on motivation and opportunity, GPS bridges the gap between advice and action, helping your patients take the steps needed to make real, sustainable improvements. Real change truly begins with GPS. The GPS method is a collaborative journey between you and your patient. It complements your professional advice, adding a practical framework to help patients turn guidance into action. With GPS, you gain new tools to build a motivation through goal setting and self-monitoring. Create opportunity through planning. At first, you'll take the lead, helping your patients set clear goals, craft actionable plans, and track progress. But over time, as their confidence grows, they'll take charge, owning their behavior change and achieving lasting success, with your support always there when needed. Let's move on and take a closer look on how you can bring GPS to life in your daily practice. The GPS method is built on behavioral goal setting. Research shows that behavior-based goals are more achievable than outcome-based ones because they fit naturally into daily routines and planning. Think of it this way. You can't directly control losing 10 kilos, but you can commit to going to the gym 3 times a week or making healthier food choices. The same applies to oral care. Rather than focusing on outcomes like plaque removal or reduced bleeding, focus on the behaviors that drive those results. Motivation starts with clear, actionable goals. But how do you ensure goals truly inspire change? That's where SMART goals come in. SMART goals help patients feel empowered, focused, and ready to take action. Here's how they work. SMART goals are specific. They define exactly what the patient will do. Measurable. They include a way to track progress. Achievable. They should challenge your patient but still be realistic and attainable. Relevant. They align with what matters most to the patient, like preventing gum disease or improving their smile. Time-bound. They include a specific time frame to create focus and urgency. Let's create a SMART goal together, something practical you can apply in your daily practice. Imagine you're working with a patient who's showing early signs of gum disease, and you want to encourage them to adopt interdental cleaning. Here's how you could frame the goal. To help prevent my gums from bleeding when I brush my teeth, I will use an interdental brush to clean between all my teeth every day before brushing at night. I'll start my bedtime routine 10 minutes earlier to make this possible. Notice how this goal is specific, measurable, achievable, relevant, and time-bound. By collaboratively shaping this goal to be SMART, you create a clear and actionable roadmap to success and motivation to follow through. Now that we've discussed how to set clear, actionable goals using SMART, let's move on to the next key pillar of the GPS method: planning. Planning creates opportunity by helping your patients visualize success. It's about guiding them to imagine performing the desired behavior at a specific time, with all the resources they need. Research shows that when patients create this mental image, their likelihood of follow-through dramatically increases. So, if you find yourself giving instructions, pause for a moment. Instead of telling your patient what to do, collaborate with them to develop a plan. This shifts the process from being directive to being collaborative, building ownership and accountability. Finally, let's talk about self-monitoring, the third pillar of the GPS method and a powerful tool for fostering motivation. When patients actively track their progress, they gain valuable insights into how their efforts are paying off. Visible improvements, like fewer instances of bleeding, become concrete proof of their progress. By regularly reflecting on these results, patients transform behavior change into a personal and rewarding journey. They not only see the impact of their actions, but also take pride in their achievements, reinforcing their commitment to lasting change. Together, planning and self-monitoring complete the GPS framework, giving your patients the tools to create opportunity, build motivation, and sustain meaningful progress. You've reached the end of Lecture 2. We hope this session has shown you how GPS can complement your current skills by going beyond advice to create lasting transformation. Now, it's time to put GPS into action. Download the GPS template and try applying what you've learned to one of your patients. It might feel challenging at this stage, but this exercise will help you appreciate the next modules, where we'll dive deeper into making the GPS method a seamless part of your practice.